Imagine that right now, inside your body, a disease could be developing without causing pain, without causing alarm, without causing symptoms severe enough to make you visit a doctor. A disease that often grows silently, quietly, patiently, sometimes for years. By the time many people discover it, it has already spread. That disease is cancer, one of the most feared diseases in human history. A disease responsible for millions of deaths every year. Yet despite all modern medical advances, cancer still has one powerful advantage. It often hides, not behind dramatic symptoms, not behind obvious warning signs, but behind ordinary changes that many people experience every day. Fatigue, weight loss, a lingering cough, changes in appetite, a small lump. Symptoms so common that they are often ignored, dismissed, explained away. And that's exactly what makes them dangerous. Because sometimes the body begins sending warning signals long before cancer is diagnosed. The challenge is learning how to recognize them. The human body is constantly communicating. Every sensation, every ache, every change, every symptom is a message. Most of the time these messages are harmless. A headache may simply mean stress. Fatigue may result from poor sleep. A cough may come from a minor infection. And that's why cancer can be difficult to recognize. Its early symptoms often imitate everyday health problems. Many people expect cancer to announce itself dramatically. They imagine severe pain, extreme illness, an obvious medical emergency. But reality is often very different. In its earliest stages, cancer may produce only subtle signals, small changes that seem too insignificant to matter. And because the symptoms appear ordinary, people frequently delay seeking medical advice. Weeks become months. Months become years. Meanwhile, the disease continues developing. One of the most important facts about cancer is this: the earlier it is detected, the better the chances of successful treatment. When cancer is discovered before it spreads, doctors often have more treatment options available. Surgery may be more effective, treatment may be less aggressive, and survival rates can improve dramatically. This is why awareness is so important. Not fear, not panic, awareness. Because understanding potential warning signs helps people recognize when something unusual deserves attention. It's important to remember that most symptoms discussed in this documentary are not caused by cancer. In fact, many have completely harmless explanations. But persistent symptoms should never be ignored simply because they seem common. Human beings are remarkably adaptable. When something changes gradually, we often adjust without realizing it. A little more fatigue, a little less energy, a little weight loss, a cough that lingers slightly longer than usual. The changes happen slowly, and because they happen slowly, they feel normal. Many people become accustomed to symptoms over time. They learn to live with them. They assume they are getting older, working too hard, feeling stressed, sleeping poorly, and sometimes they are right, but sometimes they are not. Sometimes the body is attempting to signal a problem that requires attention. Unfortunately, cancer takes advantage of this tendency. Because the disease often progresses gradually, people may adapt to warning signs rather than investigate them. Cancer is not something that suddenly appears in a single day. The process usually begins much earlier, deep inside the body, inside a single cell. When damage occurs within DNA, cells can begin behaving abnormally. Instead of following the body's instructions, they continue growing, continuing dividing, continuing surviving, when healthy cells would normally stop. Over time, these abnormal cells accumulate. A tumor may slowly develop. At first, it may be microscopic, far too small to detect. But as the cancer grows, it begins affecting surrounding tissues. The body notices, and often, the body responds. This response may create some of the earliest warning signs, not dramatic symptoms, but subtle changes, small clues, signals that something unusual is happening beneath the surface. This documentary is not designed to frighten you. Its purpose is education, because knowledge saves lives. Over the next several chapters, we'll explore some of the most commonly overlooked warning signs that can sometimes be associated with cancer. We'll examine persistent fatigue, unexplained weight loss, lumps and swelling, chronic cough, skin changes, digestive symptoms, pain, fever, night sweats, appetite changes, and many other signals people often ignore. Most importantly, we'll explain why these symptoms matter and when they may deserve medical attention, because the body often speaks quietly before it screams, and learning to listen may make all the difference. Right now, inside your body, trillions of cells are working together to keep you alive. Most of the time, they perform their jobs perfectly, but when something begins to go wrong, the body often sends messages. The question is, will we recognize them, or will we ignore them until it's too late? In the next chapter, we'll explore why cancer symptoms are so often missed, and how one of the deadliest diseases in the world can remain hidden in plain sight. Imagine a disease that can grow for years, while remaining almost completely unnoticed. No dramatic warning, no sudden collapse, no obvious sign that something is seriously wrong. Just small changes that are easy to explain away. A little fatigue, a little discomfort, a symptom that comes and goes, a symptom that feels ordinary. This is one of the reasons cancer remains so dangerous. Not because it is always aggressive, but because it is often invisible. By the time many cancers are discovered, they have already been developing for months, or even years. And during that time, the body may have been sending subtle warnings all along. Warnings that most people never recognized. Human beings naturally search for the simplest explanation. If you're tired, you assume you need more sleep. If you lose weight, you assume it's stress. If you have a cough, you assume it's a cold. Most of the time, these assumptions are correct, which is exactly why cancer symptoms are so easy to overlook, because they often imitate common conditions. A person experiencing fatigue may blame work. Someone with digestive issues may blame diet. Someone with headaches may blame stress. And because the symptoms seem familiar, they rarely create immediate concern. The brain chooses the explanation that feels most comfortable, the explanation that causes the least anxiety. Unfortunately, cancer can hide behind those assumptions. Many people imagine cancer growing rapidly overnight, but the reality is often very different. Most cancers develop gradually. The process may begin with a single abnormal cell. That cell divides, then divides again. Months pass, years pass. The abnormal cells continue multiplying, slowly building a tumor, slowly affecting nearby tissue. During these early stages, symptoms are often minimal. The body may still function normally. The person may feel healthy. Life continues as usual. And because nothing seems seriously wrong, medical attention is often delayed. This silent growth period is one of cancer's greatest advantages. The disease can progress long before anyone realizes it exists. One reason cancer can remain hidden is because the human body is remarkably resilient. When one part of the body begins struggling, other systems often compensate. If a small tumor begins affecting an organ, the body may adapt. If energy levels decline slightly, the body may adjust. If breathing becomes a little more difficult, people often unconsciously change their activity levels. The body works hard to maintain normal function. This ability helps us survive illness and injury, but it can also make disease harder to detect, because symptoms may remain mild for a long time. By the time the body's ability to compensate is overwhelmed, the disease may already be advanced. One of the biggest misconceptions about cancer is that it always causes pain. Many people assume, if it doesn't hurt, it can't be serious. Unfortunately, that isn't always true. In fact, many cancers cause little or no pain during their earliest stages. Some tumors can grow significantly before pain develops. Pain often occurs only when cancer begins affecting nearby nerves, organs, or tissues. This means waiting for pain can sometimes delay diagnosis. Cancer does not always announce itself through suffering. Sometimes it announces itself through subtle changes. Changes that seem too minor to matter, at least at first. Another reason symptoms are ignored is fear. Sometimes people notice something unusual. A lump, persistent fatigue, unexpected bleeding. But instead of seeking medical advice, they avoid thinking about it. Part of them worries about what they might discover. So they wait. Days become weeks. Weeks become months. The symptom remains, but the fear remains too. Psychologists call this avoidance behavior. It's a natural human response. When faced with uncertainty, many people hope the problem will simply disappear. And often it does. Many symptoms resolve on their own. But when symptoms persist, avoidance can become dangerous. Because cancer does not disappear simply because it is ignored. Many people believe cancer only affects older adults. While age is certainly a major risk factor, cancer can occur at almost any age. Young adults can develop cancer. Middle-aged adults can develop cancer. Even children can develop cancer. Because of this misconception, younger people sometimes dismiss symptoms. They assume, "I'm too young. It couldn't happen to me." But disease does not always follow expectations. This is why persistent symptoms deserve attention regardless of age. Cancer may be less common in younger populations, but it is never impossible. Doctors often focus on one key word: persistence. A symptom that appears once may not mean much. A symptom that continues for weeks or months is different. Persistent fatigue, persistent coughing, persistent pain, persistent changes in appetite, persistent weight loss. The body occasionally experiences temporary problems. That's normal. But when symptoms refuse to go away, they deserve investigation. Persistence is often one of the strongest clues that something deeper may be happening. Not necessarily cancer, but something worth understanding. Nobody knows your body better than you. You know what feels normal. You know your energy levels, your appetite, your routines, your habits. And because you know your body best, you're often the first person capable of recognizing when something changes. That awareness can be powerful. It can lead to earlier medical evaluation, earlier diagnosis, earlier treatment, and in many cases, better outcomes. The goal isn't to become fearful of every symptom. The goal is to remain aware, to notice changes, to respect persistent warning signs, and to seek professional advice when something doesn't feel right. Cancer often hides behind ordinary symptoms. It disguises itself as fatigue, stress, aging, minor illness, and because the warning signs appear familiar, they are frequently ignored. But awareness changes everything, because the sooner unusual symptoms are recognized, the sooner action can be taken, and sometimes, that action can save a life. In the next chapter, we'll explore one of the most common and most overlooked warning signs associated with cancer: persistent unexplained fatigue. If you enjoyed this documentary, subscribe to Inside the Human Body for more cinematic videos exploring cancer, disease, human biology, and the hidden science of life itself.